Disease reversal. How new scientific breakthrough gives you natural healing. We help people heal naturally. Symptoms of Lyme disease are brain fog, zapped energy, can't move, unexplained rashes and fevers, stolen desire, debilitating pain to keep you or your loved one from an abundant life. Or maybe you've been told that you have Alzheimer's, MS, Parkinson's, ALS, arthritis, chronic fatigue, fibromyalgia, or some other catastrophic disease. All these are common misdiagnoses of Lyme disease. In fact, brains taken from the Alzheimer's brain bank have shown that 75 to 100% of them are infected with Lyme bacteria. The same is true with MS. It's been found in the other diseases noted here. How about you? Do you have one of these misdiagnoses also? Let me tell you about somebody who came into our office a while ago. Her husband had to carry her in because she couldn't walk. She'd been under the care of some local docs doing the typical therapy that most people get. And she's getting worse. She's getting worse very quickly. In fact, she believed that she was dying. Her eyes were dark, sunken, irises were yellow, no color in her skin, no life in her eyes. Although she was a very intelligent woman, she couldn't even converse normally. She couldn't walk. She couldn't talk. In a few short weeks, she's out walking again. She's been talking. It's been a process, but she's been turning around. In fact, you can read her story. A link to it is attached below here. What she found is the same for you. The barriers to healing weren't what she thought. A quote from the book of Hebrews, so we see that they were not able to enter because of unbelief. This is true in almost every area of life. We'll only pursue the things we believe, whether we believe them ourselves or we're influenced by others. It ain't what you don't know that gets you into trouble. It's what you know for sure that just ain't so. This quote from Mark Twain is how we will enter into looking at the scientific literature to show what's going on with this terrible disease. A cover story from Business Week, coining it medical guesswork, is citing a study from the New England Journal of Medicine that says the portion of medicine that has been proven effective is still outrageously low, in the range of 20 to 25%. The article goes on to state that it's financial incentives for both the providers and the patients that encourage the poor care and the poor outcomes. A recent study in the Journal of American Medical Association found that 40% of the best studies in the world have what's called spin on them. In other words, the findings of the studies are twisted to encourage financial incentives rather than the truth, and they commonly misrepresent what the studies have shown. It suggests that up to 70% of the studies done in the United States have spin on them. A quote from medical doctor Mark Hyman says, unfortunately in our healthcare system, business trumps science every time. An article from the Journal of American Medical Association talking about medical education says these in quotes, despite changes that have been made, the fundamental approach to medical education has not changed since 1910. Medical education should prepare students well for the clinical problems they will face in their future practice. However, that's not happening for the most prevalent problem in healthcare today, chronic disease. Time magazine, quoting more research, gives a cover article, The Secret Killer, that being inflammation. We find that the major cause of inflammation are trauma, toxicity, chronic stress, infection, and nutrient insufficiency. Rarely are any of these causes addressed in the treatment of inflammation. So why are we going to talk about this now? We're presently in the age of what I call the age of misinformation. We have so much knowledge with no basis to process it because we don't understand the processes that are involved. We're up here in the upper Midwest, the epicenter for Lyme disease, and I just can't be quiet about this anymore. In fact, a little of my own history. When I was a young child, somewhere around 8 years old, I got sick. Had no idea what it was, just felt like I had the flu all of the time, 365 days out of the year. That went on for years, and I began to realize as a young child, if I ate differently, I felt better. That started a pursuit into natural health care, and nutrition that have followed. Right now, have 25 years of postgraduate education in nutrition and practice in nutritional medicine. So we go back to the quote from Mark Twain, "It ain't what you don't know that gets you into trouble, it's what you know for sure that just ain't so." The history of Lyme disease was found in Lyme, Connecticut in 1975 when a strange new arthritis was found in young people. Later that year, the Center for Disease Control gave the treatment protocol of antibiotics for 2 weeks. That was 2 full years before they figured out what carried the disease, being the black-legged tick, and 7 years before they found out what caused it, being the Borrelia bacteria. This is what Borrelia bacteria look like. They're a corkscrew type of a shape. The diagnosis for Lyme, or borreliosis, more accurately, is a bullseye rash, which is there way less than 50% of the time. Rocky Mountain Labs has isolated 300 strains of this bacteria. 99% of the tests use a B31 strain of Borrelia that's missing 4 chromosomes, and it was extracted from a tick, not a human. That's important because Borrelia bacteria are close cousin to syphilis. They mutate or change quickly. They'll move out of the blood quickly because they don't like oxygen and they don't want to be close to your immune system. They'll copy your protein very quickly and cover itself very much like a snail shell covers a snail, so your immune system can't recognize it. When they're threatened, they make a biofilm that the antibiotics can't penetrate. When the biofilm is fixed, it stays there. When it floats, it moves through your bloodstream as an embolism. It can cause strokes and heart attacks. Inside the biofilm, it can communicate and multiply. Babesia, another common co-infection of Lyme disease. This is a protozoa infection of your red blood cells that you see here on this blood smear. The lab tests are only available for 3 of the 36 known species of Babesia. The blood smears are only accurate in the first 2 weeks of infection, like the one shown before. The symptoms of babesiosis is fevers, anemia, with low oxygen and low energy. Ehrlichia, another common co-infection, is a bacterial parasite that invades one of your white blood cells called the monocyte. The white blood cells are your immune system. They're supposed to kill things. Their lab tests for Ehrlichia are sensitive only in the first week of infection, and blood smears like the one just shown are less than 20% positive for this bacteria. Rickettsia, another common co-infection, has 26 different strains of the bacteria that infect the cells that line your mouth, nose, gut, and blood vessels. This is what a rickettsia infection looks like. The symptoms of rickettsia are sudden fever, rash on the soles of the hands and feet that spread over the entire body. The Center for Disease Control says this about testing for rickettsia. The greatest challenge to clinicians is the difficult diagnostic dilemma posed by these infections early in their clinical course when antibiotic therapy is the most effective. All bacteria make ammonia when they eat proteins. They make it through this cycle where the animal protein is eaten across the top. It turns into ammonia on the left side. If there's more bacteria, it'll eventually go through a process and end up being nitrogen back in the atmosphere. But we don't have those bacteria inside of us. It stays there as ammonia. Well, ammonia burns your cells much like acid will, only it's a strong base. Ammonia burns your nerves, your brain, your muscles, your cartilage, and any other tissue or cells that it's close to where the infection is. The lab tests are available only for systemic ammonia. That means it's throughout the entire body. You can't detect local toxic ammonia. The only way you could possibly do that is take a biopsy, which is to punch into tissue. You can't do that if you don't know where the infection is, and there's no lab test that will tell you where the infection is. The ammonia kills your mitochondria where your cells make energy. Therefore, your cells can't make energy. This is a picture of a dying mitochondria. This is what ammonia does inside your cells. It kills mitochondria. This is a rendition of a picture of what a mitochondria should look like: vibrant, full, and healthy. It's in the mitochondria where you make most of your energy by this process here. Your food supply comes down from the top under the heading of glycolysis, drops down in the mitochondria where most of your energy is made. With ammonia, it kills this process so you can't make energy. This is the way our bodies are designed to deal with ammonia. It's called the urea cycle. We make ammonia when we start to process proteins. That should go through a process making energy and spill out as urea on the left. But this only happens in the liver. And toxic ammonia can't get to the liver. It's bound up in the tissues, and it stays there and burns. So we know this about Lyme disease so far. It's from a smart bacteria, with a fair amount of smart bacteria can be with it along with other infections. The smart bacteria can wall and cloak themselves so the immune system can't find them. Within the walls, the antibiotics can't reach them. They make toxic ammonia. The ammonia burns. It will kill your mitochondria and make it so that you can't make energy, and the lab tests are inadequate at best to detect these things. The treatment was established in 1975 by the CDC, the same year that the disease was discovered, but the cause wasn't found till 7 years later. There's 6 officials that get royalties every time you get a lab test or administer the treatment. Citing 36 studies on Lyme disease, Tom Greer states, in Why the Controversy Over Diagnosing and Treating Lyme Disease. In 1982, when the cause of Lyme disease was known to be bacteria, early medical papers reported that, as in other bacterial infections, 2 weeks of antibiotics should be adequate, citing 5 studies. Dozens of medical papers since 1982 have documented antibiotic failures in the treatment of Lyme disease, citing 31 studies. He continues, in every antibiotic treatment study since 1982 that followed Lyme patients post-treatment for at least 3 months, there have been reports of relapses occurring. We're going to have to continue this in the next video.